Our presenter today is going to be Ryan Parker. Ryan is a graduate of the University of Utah and the University of Michigan Law School. He worked as a trial attorney with the Department of Justice for approximately 10 years, where he also served as the Chief Litigation Officer at the Office of the Director of National Intelligence. He was lent out to them because he was outstanding. And then he joined us at SixFifty, where he's the Vice President of Legal Product. Ryan is currently joining us from the DC area, and we're happy to have him take over today.
Thank you, Marie. Appreciate the introduction. And I'm looking forward to today's discussion. Thank you for joining our webinar, Creating an Effective Vaccination Policy. This is an interesting area that I think is still very much in development. And I hope that we'll be able to have sort of both a presentation and a discussion. And I would encourage you, if you have questions or insights that you want to share, to use the Q&A button to put those questions or insights in so that we can discuss them. This is an interesting area that a lot of businesses are going to face over the next several months. At SixFifty, we have created a return to work tool set that we have deployed to help hundreds of businesses with the return to work. And one of the most frequent questions that we've gotten over the last several months is, what about vaccines, vaccination policies? And so we worked with the attorneys at Wilson Sonsini and to create a vaccine policy. And so we have put a lot of thought into vaccine policies and what the options are and how they work, and some of the nuanced issues that come up as you're creating a vaccine policy. And we thought it would be helpful to share some of those insights that we've learned, and to frankly take your questions and to see other thoughts that you may have as we move forward. So as an agenda here for our program, I want to start by looking at the current state of the law regarding vaccination policies. Then we'll move into a discussion of vaccination policies themselves, and specifically mandatory vaccination policies versus voluntary policies, what some of the benefits of mandatory policies might be, what some of the benefits of voluntary policies are. And then we'll move into some of the best practices in creating a vaccine policy. Before I launch into our webinar, I do want to mention that about a month ago, SixFifty hosted a webinar with Dr. Daines and with Marina Satalis, an employment specialist from Wilson Sonsini, where we covered what a vaccine is. And Dr. Daines provided a really fascinating history of vaccines, and specifically some interesting information about the development of the specific COVID-19 vaccines. And then Marina talked about some of the legal issues that accompany vaccines. And so if you're interested in that, we will send that a link to that video out as well. Our discussion today, though, will focus more on vaccination policies and some of the pros and cons of different policies, and what the law is there. And so I just wanted to flag for you, if you're interested in our earlier webinar, we'll send that out in an email following this webinar, and you can take a look at that as well. I would highly recommend it. So why don't we launch into the current legal guidance regarding vaccination policies. In late 2019, there were significant questions about what would be permitted and what would not be permitted as far as vaccinations. And there were many who tried to compare sort of the way that the EEOC, which is the Equal Employment Opportunity Commission, would address COVID-19 with the way that it had addressed previous things like flu shots or N1H1 that it had addressed in guidance in the past. And then on December 16th, 2020, the EEOC put out some interesting guidance about vaccination policies regarding COVID-19 and what is and is not permissible. And so I've provided a link in the slides. I think we already had this question, but we'll provide the slides with a follow-up email following this presentation so that you can follow that link to the EEOC's guidance. A lot of what we're going to talk about with the current legal guidance aspect of this webinar is drawn from that EEOC guidance. They also have a link, and I'll just flag this, to all of their COVID-19 materials. And so you'll get the slide deck and you can follow these links to everything that the EEOC has issued about vaccination policies. And the EEOC is really the primary government body that's addressed this issue. But what they came out with on December 16th was guidance that said that employers generally can require that employees receive the COVID-19 vaccine to enter their workplaces. But they may need to provide reasonable accommodations for individuals with medical conditions or religious beliefs that preclude them from being vaccinated. This, for most people, was not a surprise. It was consistent with how the EEOC had addressed other issues. I will say, as an aside, we have worked with several different law firms to create international versions of our return to work tool set. And we recently had a webinar where we discussed vaccinations, and it was interesting to note that in many of the European countries, the view was that the governments would not allow their employers to require vaccinations. And so this, I think, is something that's maybe somewhat unique in the United States, in that the EEOC has said employers can require that their employees receive the COVID-19 vaccine in order to enter their workplace in most situations. Marie, can you move us to the next slide? So the flip side of that coin is that currently employers do not have to require their employees to receive the COVID-19 vaccine to enter their work site. The Occupational Safety and Health Administration, OSHA, does have a requirement that companies provide each of their employees with a place of employment that is free from recognized hazards that could cause serious harm. And that's paraphrased, and I provided the citation. But that requirement from OSHA gives rise to a lot of other things that businesses need to do. And there's been some speculation that OSHA could perhaps say that a work site that does not require people to be vaccinated is not safe, but that has not occurred. And frankly, I would be a little surprised if it does occur. Now, the other place that we could see a requirement arise is in the state occupational safety and health agencies. And if I were a betting man, I would look particularly to Cal OSHA, the OSHA that's set up by the California state government, that has been extremely active in addressing COVID-19, as one place where you could see a requirement that businesses have all of their employees vaccinated before they come back to the work site. But as things currently stand, businesses are in an interesting situation. In fact, I believe that many businesses would probably prefer if the government said either you don't have to vaccinate your employees, or you are required to do so. Or, I'm sorry, if the government said you cannot require that your employees be vaccinated, or that you are required to have all your employees vaccinated, because then they wouldn't be sort of pulled into what could be, I think, a very contentious issue here, where businesses are left to have to decide for themselves whether they're going to require vaccinations or not. It's interesting, and many of you may have had a similar experience, but I have recently talked to several people who cannot wait to receive the vaccine. They are regularly checking with their states. They're trying to sign up as quickly as possible. And other people who are concerned about the vaccine, are concerned that it wasn't adequately tested or that it was rushed, and that have concerns. And it's interesting, the variance that we see. And I think that businesses are going to have to thread a difficult needle here with especially large businesses that may have some individuals who not only want the vaccine, but want to work in a workplace where everyone is vaccinated, and other individuals who may be hesitant to receive the vaccine. And so I think that it really puts businesses in a difficult spot and requires them to wade into this issue that could be contentious, I think, in the workplace. So when businesses are looking at this issue, as we move to the next slide, they have a couple of different ways that they can handle the vaccination policy issue. One, they can require their employees to be vaccinated before they return to the work site. And I'm really speaking at just as an example of businesses that are currently remote and would maybe have employees come back as they're able to be vaccinated. You could also see businesses that are currently in the office or partially at their work sites who require employees to be vaccinated by a certain date. There are different ways that this could be put in place. A second option is to do nothing. You know, employers are not required to mandate vaccines, and employees could, step back and decide they're not going to address vaccinations at all. And a middle ground is that employers could encourage vaccinations without requiring them. And they could do that through a policy, they could do that through incentives, and we'll talk a little about each of these options. But I want to take just a minute because I do think that there are a number of factors that businesses need to consider, that there's a real balancing that businesses are going to need to do as they're thinking through the right vaccination policy for their specific business. And so let's look at some of the potential benefits of requiring vaccinations. And I would be interested if people have other benefits that they can think of. Feel free to add those to the Q&A or to the chat. But one, certainly maybe the most clear benefit of requiring vaccinations is protecting employees, customers, and others who enter the work site. A lot of businesses have had outbreaks and have had other issues during the pandemic with COVID-19. And I think requiring vaccinations and only having individuals who have been vaccinated in your work site is one way to protect employees, customers, and others who enter the work site. Vaccinations could also reduce employee sick days and the need for medical care. Obviously, COVID-19 is interesting in that it affects people differently, but certainly there have been many cases where employees have missed a significant amount of time because of they have suffered from serious symptoms of COVID-19. Businesses could also reduce the risk of having to close because of a COVID-19 outbreak. Many businesses across the country have had to close for a time because they've had outbreaks. Often state health agencies or state OSHAs have requirements that if you have so many outbreaks in a business, you're required to close. Some businesses have closed of their own volition in order to clean or to give their employees time to recover. But having a vaccine, I think, would lessen the likelihood that businesses would have to close. Another is it could reduce the risk of civil liability or administrative enforcement action. And we talked a little about administrative enforcement action earlier. You could have state health agencies or others that come and are looking into your business. If everyone at your workplace has been vaccinated, that seems very unlikely. It also seems that if your employees have been vaccinated and are less likely to get sick, you're less likely as a business to be sued by employees who get sick. And if you are sued, you can say, point to the fact that you have required vaccinations. You've really gone to great lengths to protect employees.
Ryan, sorry, I was just going to weigh in there for a second. We had a comment in the chat that was on this point where they mentioned that it's been suggested that you may also see a competitive advantage to requiring the vaccines once they become more widely available.
Yeah, I think that's a great comment, and I appreciate that. It looks like Kim Dockstader, really, really good comment. And I think that could play out in a couple ways, right? That could be a competitive advantage potentially in hiring. You could also see that an advantage, I guess as a consumer, I may be more comfortable going to businesses that I know are requiring all of their employees to be vaccinated. And so I do think that's an interesting one that we could see play out, that businesses may actually advertise that if you go into, for example, a retail store, that all of the employees in there have been vaccinated. Thank you for that. And I definitely welcome other thoughts. Potential drawbacks, and these are interesting. I will say, and we'll get into this a little later on, that a vaccination policy could require significant resources to administer. If you're going to require vaccinations, you're going to have employees submitting proof of vaccinations. You're also going to have, and we'll talk about this in quite a bit of detail later on, but situations where employees are requesting exemptions from your vaccination policy, either because they have a disability or because they have a religious belief that would prevent them from being vaccinated. And that could take up significant resources because those are not easy situations and they need to be handled carefully. You could also have a situation, and frankly, I think this goes back to the comment, and I think this cuts both ways, that could negatively affect employee morale and retention. I wonder kind of how this would cut, but I think that you could have employees who feel that they shouldn't be told by their employer what to do, and specifically employees who are concerned about vaccines in general, or more specifically about the COVID-19 vaccine and how quickly it was developed. And so, that's another issue that I think businesses need to think through as they're contemplating whether to make vaccinations mandatory. We're returning now to the exemption request that I mentioned earlier, but there could be an increased risk of discrimination suits regarding accommodations. And we'll have a more detailed talk about accommodations, but employees, if a company introduces a mandatory vaccination policy, employees will be able to request exemptions based on a disability or a religious belief. And if the company's not able to accommodate them, they could be facing a discrimination suit. And those suits can be difficult. And frankly, the accommodation policy itself can be difficult. And so I think that's something that businesses probably need to keep in mind. Another thing that businesses probably will want to think about is just the nature of their business, right? And this also goes to really whether you're permitted to impose a mandate, a vaccination mandate. But if you are a team of, we're a technology business, so if you're a team of computer engineers who all work remotely, and you never go to a work site, then it really doesn't. The benefits of having everyone be vaccinated, I think, are largely mitigated. On the other hand, if you're a retail establishment that has people coming in and out of your doors, and where your employees, or an establishment where your employees are working closely together, those benefits could be higher. And so some businesses may want to kind of look at their business model and the way that their employees interact with each other, and also with customers. So Marie, let's take just a minute and look at some of the thoughts in the chat, if you want to tee those up for us.
Yeah, sorry. And just as a reminder, if you can put the questions into the Q&A as opposed to the chat, that helps us track them, so that if we don't get to them, we do send the answer in the follow-up email. But there's a couple that touch on what you've been discussing right now, Ryan. One of them being whether there might be liability issues in terms of if you have a requirement and then you have an employee who has a negative reaction to the vaccine, was one of the first ones.
Yeah, no, I think that's an interesting question. I do think that we'll get to an issue related to that, but I do think, we'll just jump to it now. One of the things that happens often with the flu shot is that, at least in my prior life in the government, I actually just went to my employer and they gave the flu shot. And I know a lot of large employers will offer that. There are a number of reasons why that's not a good idea with the COVID-19 vaccine. And I think one of them may be related to what you have touched on there, that I think it's best to have people go through their own healthcare providers and to be vaccinated in that way. And in part, I think that is at least separates the business one step from questions about if someone has a negative reaction to the vaccine. So I do think that's an interesting question, and it's one that may come up. I'd have to think a little bit more about it, but I do think that's something to keep in mind.
Thanks. And then we also had a question that came through, I believe, in the chat, where there's just a little bit, if you could explore a little bit more in terms of religious exemptions and how that might, whether there are documentation requirements around that, how would employers best approach if they had somebody request a religious exemption?
That's a great question. And I actually have a couple of slides that touch on it in the best practices section. So I'm going to come back to it. And if I don't answer it to your satisfaction, please repost your question or follow up. But I do think the documentation requirement and some of the ways that that is handled are important and are things that a business wants to think through carefully. And there's something I'm going to discuss in the best practices section.
Thanks. And I will say we had a question come in about whether these are this is U.S. guidance only. It is primarily U.S. guidance. Ryan can throw in a few things here and there about the EU specifically because he's also been working with the EU, but this is all around U.S. requirements specifically. Um, in terms of, I know some people were asking about the approval process happening in the EUA for the EEA, sorry. That's sort of beyond the bounds of what we're talking about today, but we may see if we can get you some information in the follow-up email.
Yeah, thank you, Marie. And that is an interesting question. This webinar is really based on guidance we've received from the EEOC in the United States. I do think it would be interesting for us, and we have actually discussed with some of our colleagues at Taylor Wessing about getting together and having a discussion about some of the differences between how EU countries and how the United States are handling vaccines and vaccination policies. So that's something that we've thought about. It won't be covered here, but it's watch for future webinars because I do think that's a very, very interesting area.
Thanks. And then there are still some other questions in the chat, but I believe that they're things that we're going to address as we continue moving forward.
Thanks, Marie. And we'll have a time for questions at the end as well. If we end up not answering those questions, we can circle back to them. So we talked about this before, and this is the middle ground policy, right? Encouraging vaccinations. And this would be a policy where a company encourages its employees to be vaccinated, but doesn't require the vaccination. And this is, I think, an interesting option. It provides some of the benefits of requiring vaccination, but not to the same extent. So it certainly could provide greater protection for employees. It may reduce sick days. There may be some reduction of the risk of having to close if a large number of your employees choose to be vaccinated. And there could be some risk, I think, of civil liability or administrative enforcement action, both from the fact that I think you're less likely to have an outbreak and that you've taken some steps to try to make your workplace more safe. That being said, I think those benefits are not as great as they would be with a mandatory policy. Potential drawbacks, you're still going to have to administer the policy. And so you're going to have a lot of the same administrative burdens, although I would say somewhat less, because you won't have to have people seeking, most likely you won't be in a situation where people are having to seek exemptions for a voluntary policy. And then, you know, the thing about this vaccination issue is that people feel very passionately about it on both sides. And I think one of the difficult things for businesses is they may, you may not be able to keep everyone happy. Even with the middle ground, you may have some people that feel like you haven't gone far enough and that they don't feel safe in your workplace because you haven't required vaccinations, and others that feel that you shouldn't be sort of pushing them to be vaccinated. And so you may still run into that, although I think it is likely to be less with this sort of middle ground. So those are our three options, and there may be other options that emerge, but I've tried to sort of break them down into large buckets. So businesses really are in a unique position where they need to be thinking about, you know, what should I do with vaccinations? What's best for my business? And what are the pros and cons of the different options before me? So we promised this before. I'd like to just dive into some of the best practices for a vaccine policy. And what I'm going to do is start with general principles for any type of vaccine policy. And then I'm going to talk about best practices for a mandatory policy and then best practices for a voluntary policy. So this is always a key, is to have a clear written policy that you can provide to your employees so they understand exactly what you are asking them to do and what you're requiring them to do. You need to distribute it to your employees, and you need to explain the reasons for the policy. For example, you can say, we're committed to the safety of our employees, customers, and all who enter our workplace. Your employees need to understand that you have thought through the issues closely and that you are taking a reasoned approach. Uh, and that can sort of inspire confidence both in your company's leadership, but also help them to sort of understand why you're asking them to do what you're asking them to do. And then lastly, you need to provide a clear contact point for questions about the policy. This is a policy where I think you're more likely to receive questions than many of the other policies that you may have gathering dust in your handbook. This is one I think that people feel very passionately about. And I think that providing a way for employees to reach out and ask questions and get clarification is important. So let's dive into, and I want to make sure we save some time for questions, so I'm going to move somewhat quickly, but let's move into the best practices for a mandatory policy. I touched on this before. With some companies may be used to bringing people in to do flu shots. Either, when I was at the Department of Justice, we actually had a nurse on staff who would just give everyone flu shots. I know some companies contract with a third party to administer the vaccine. But one of the things in a mandatory policy that's a little bit of a trap, I think, is that before you can receive the COVID-19 vaccine, you have to be asked certain medical questions. And those questions, there was in the guidance provided by the EEOC explained that those questions constitute a medical exam under the ADA, the Americans with Disabilities Act, and that there are very strict restrictions on when you can require employees to have a medical exam. So getting a vaccine is not a medical exam, but if you are asking them the questions, or someone that you have contracted with directly are asking the questions, you do run into this medical exam issue. Another best practice is if you're requiring people to get vaccinated from their own healthcare provider or at a pharmacy, depending on how vaccines are being rolled out, it's a best practice, and in many states you'll be required to pay individuals for the time that they're being vaccinated. And so, that's something that you want to build into your policy, is that people can take the time they need and not have to use leave in order to be vaccinated. I think a good policy probably also needs to explain that doesn't mean they can just leave whenever they want without giving prior notice. There's some explanation of what's required, but the fact that you're requiring people to be vaccinated, I think it follows that you should pay them for that time. Marie, can we
Sorry,
move?
I was going to throw in one comment that connects that to a question. Along those lines, there was a question about whether you could, for example, require vaccinations just for attending a specific event if you're a remote workforce, but having, an employee event. And then there was another question about having the policy where based on job requirements and exposure factors, so you would require some employees but not others to get vaccinated. Both of those are great questions, and I'll just lead in and let you finish it off, Ryan. But under the EEOC, essentially, keep in mind what your requirements are as an employer. One of them is providing a safe workplace to your employees. So, if you can look at your employee workforce and determine that based on their job description and requirements, some employees are more at risk than others. Say they work on a factory floor and they're in close conditions, whereas you have other employees that may be able to work remotely. Having a policy that accounts for that would go towards that goal of providing a safe workplace. So again, like if you do something like that, I would say you can, but you want to make sure that it's reasoned, and that as you enforce that you do think through the accommodations question, because there will be more nuanced accommodations with a more nuanced policy. Just like if you're having some people come in for an event, even though you're typically all remote, you need to think through, can you really require, does it make sense to have a required vaccination policy if they're really just coming into the workplace for this one event?
Yeah, I agree completely with Marie. In fact, I think that if you have a workforce that has very different risks of exposure, it may make sense for you to handle those groups differently. And I think that you do, as Marie said, want to keep in mind sort of the underlying principle that you have a requirement to provide a safe workplace. And so you may have situations where you have some employees who work remotely and it isn't as much of an issue, and you have others who, as Marie said, are working in a factory or the like. I think that the issue of like an event or something where people are working remotely but they come just to an event is an interesting one that you would have to think about. And I think it might depend on the nature of the event. If it is a work event, that I think falls within OSHA's requirement to provide a safe workplace. And so I do think, a company may want to think about sort of, is the event going to have a large number of people inside in close quarters, and think about that. If it's an outside event, or if it's, the way that it's organized, you don't think that's as much of an issue, that would be something you'd want to take into consideration. But I do think you could have a requirement that people be vaccinated, for example, in order to attend an event in person that is also available, for example, online, through a Zoom platform, for example. So I think those are really interesting questions. And they're the type of questions that I think we're going to see come up as vaccines become more and more available. Right now it's primarily healthcare workers. Some states are vaccinating their teachers, which I think is great. And then, people who are in at-risk groups. But I think as the vaccine becomes more available, we're going to have more of these types of situations that come up. So let's look at, best practice part 2. And this is where we start to get into a little bit about accommodations. And I have a couple of slides on this, but we'll touch on it here. If you're going to have a mandatory policy, you need to have a clear process for individuals to verify that they have been vaccinated. And my understanding is that after people are vaccinated, they're typically given a card or some sort of documentation that they could provide that shows that they've been vaccinated, or to seek an exemption from the vaccine requirement because of a disability or sincerely held religious belief. And so what we've done actually with the vaccine, the policy generation engine that we've created, is that if you're able to customize the policy. If you create one that requires employees to be vaccinated before they return to the workforce, it also comes with it a standard vaccine verification form that's generated. And people then can submit that with their proof of vaccination, or they can check a box that says they're not going to be, or they need an exemption because of a disability or because of a religious belief. And on our form, actually, it's interesting, there's a distinction, and this goes back to a question that we had earlier, between asking for an exemption for a disability and asking for an exemption because of a religious belief. The form says specifically, it has a checkbox for a disability and then says, please do not provide any additional information about the disability or a diagnosis or any other personal information on the form. And I think that's important, because you don't want that information on a form. I think the better practice is to then call those people and engage with them on an individual basis to talk through accommodations and their needs. On the other hand, that is not the information about a religious belief is not as sensitive. And the form that we have actually has a little line that says, just describe kind of what your concern is there. And so I do think it's very important on that verification form that you do not, or that you specifically instruct people not to put medical information beyond that they have something that would make them uncomfortable or would prevent them from getting a vaccination. Let's move to our next slide. So let's just a couple more thoughts on this. One thing that you'll want to include also in a mandatory vaccination policy is an explanation that the company will reach out to individuals who request an exemption from the policy to discuss their specific situation. You just want to let people know, listen, if you check one of these boxes, we'll reach out to you so that we can work this through on an individual basis. And then you also want to explain that a company will not discharge or discipline employees who request an exemption from the policy in good faith. That you're not going to discriminate against people who ask for an exemption if they're doing so in good faith. And I think that's important because you don't want individuals to feel like they can't ask. I think that is not good for employee morale and could leave you vulnerable in a discrimination suit where they feel like they were not able to ask for the accommodation that they needed. Okay, so here's the big question that we get over and over and over when it comes to vaccination policies. And so I thought I'd just kind of take it head on. Can a business fire an employee who refuses to receive the COVID-19 vaccine, but has not requested an exemption because of a disability or religious belief? And I'm going to give you a very lawyerly answer, which is maybe. And I think in a lot of situations, the answer is yes. The ADA allows an employer to have what it calls a qualification standard. And that standard can include a requirement that an individual shall not pose a direct threat to the health or safety of individuals at the workplace. And so if you have a workplace where people are coming in and they're using the elevator together and they're walking in the door together and they may be run into each other in the hallway or in the restroom or in your kitchen or your common area, or maybe they work in a situation in a warehouse situation where they're moving and they're going past each other. I think you would have a very strong case that not being vaccinated could expose others to the vaccine. And so I do think that in a lot of situations, if an employee simply says, I don't want to be vaccinated, I just don't want to do it, and you feel like that would pose a threat to the health and safety of individuals in your workplace, I think that the law supports your ability to let that individual go. Now, let me give you a very lawyerly caveat that these are tricky situations, and I think that I would consult your general counsel or outside counsel before taking those steps. But I think generally that's what the guidance supports. You know, one of the things that you would want to look at specifically in that situation is how likely is an unvaccinated individual to expose others at work to COVID-19? And this goes again to the type of work that your employee is performing and frankly, the nature of your workplace, right? Again, if you have a workplace where people are coming in and out and where they're, you know, passing each other in the hallway, this seems like you have a pretty strong case that someone could be exposed at work. You know, in other situations where employees are typically working at home or maybe completely working at home, you know, that need is not going to be as strong. Let's move to part 2 of our big question here. What about, can a business fire an employee who cannot receive the vaccine because of a disability or religious belief? And this is a question that we've gotten as well. So under both, the thing that's interesting about disability and religious belief is that they're covered by different employee discrimination statutes. So the ADA, the Americans with Disabilities Act, covers people who ask for an exemption because of a disability, and Title VII, which prohibits discrimination on the basis of religion, would cover someone who asks for an accommodation or an exception because of a religious belief. And so if someone comes and says, I can't be vaccinated because I have a disability that precludes me from doing so, a business is required to give them a reasonable accommodation if doing so is not unduly burdensome. This is a very complex area of the law. Those of you that have dabbled in employment law know that there is just books and books worth of case law on what a reasonable accommodation is and isn't and what undue burden means. So I'll just hit the high points. A reasonable accommodation does not mean that the employee gets whatever accommodation that they want. It means that it's an accommodation that's reasonable to fit the needs, and unless it's unduly burdensome. So one of the things that's interesting here is that the meaning of the term undue burden is different under the ADA than it is under Title VII. Under the ADA, when we're talking about a disability, a reasonable accommodation is not unduly burdensome for a business unless it is imposes significant difficulty or expense. And that can be a relatively high bar. in accommodating a disability, companies need to really look at what they can do to accommodate an employee, that can include an expense or difficulty. You know, and courts tend to look at this, I think, very favorable towards individuals who bring suit, and really put this burden on companies. And so this is where I think a company needs to be thoughtful about how they handle accommodations. I also think that as a business practice, there's a lot to be said for companies that go out of their way to protect and take care of their employees. And I think that this is an example of a time where a business can do that. Interestingly, when an employee asks for a religious exemption, the undue burden standard under Title VII is much, much lower. Essentially, an accommodation would be an undue burden if it is more than a de minimis cost or burden on the employer. And for those of you that love when lawyers use Latin terms when explaining things to you, I'll tell you that de minimis means nothing. If it's more than nothing, essentially, of a cost or a burden, it really, de minimis means like the smallest bit. And so here, you know, the requirement to accommodate someone who needs a religious or who requests a religious exemption is not as high as sort of the requirement to accommodate someone who needs or requests an exemption for a disability. That being said, and I mentioned this earlier, I think there are good reasons for companies to do what they can to take care of their employees whenever possible. And it does not mean that there is no risk if they're unable to do so. But I did think that distinction is interesting. And I will say again that this is a very complex area of the law. What constitutes a reasonable accommodation and what meets the undue burden standard, you know, there are a lot of different issues at play here. And so if this is an issue that your business faces, I would strongly suggest that you discuss your specific situation with your general counsel or your legal team or with outside counsel.
And Ryan, I'll just weigh in here really quick from the chat. There was a question along these lines about, you know, what's the reasonable accommodation since so many companies have been working remotely for the last 9 or more months. And the answer is, you know, that may have changed what is considered reasonable, because you now have seen that, you know, maybe whereas before the answer was, you know, it's not reasonable for us to let you work from home, maybe now the practical outcome of having a remote workforce is that that's no longer going to be considered a correct answer if you have that type of workforce that has been working remotely. So we'll definitely probably see some changes in this coming up. And similar, also just say somebody was asking about, we're talking about, you know, religious belief. What about, you know, there's a lot of beliefs regarding vaccines that aren't based on religious, but on other convictions about, you know, the safety of them, but also there's, you know, some further out there situations where, you know, there may be concerns about, you know, if the vaccines themselves are safe because of conspiracy theories and other things, if you wanted to comment on that.
Yeah, no, I think I really appreciate, let me just say out the questions that we're getting, because I think they're really interesting. And I'm going to answer one that I just saw in the question, and then I'm going to come back to that one, Marie. I thought there was an interesting question in here about how the COVID-19 vaccine differs from the flu shot, and a comment about how you know, employers haven't been able to terminate employees who decide not to get the flu shot. And I think that a lot of that has to do with the fact that the EEOC has recognized that COVID-19 is a threat and has categorized it as a direct threat. And because of the nature of being a direct threat, employers are able to take steps that they're not able to take with regard to things that are not a direct threat. And I think the flu is one that has not been labeled as a direct threat. And so there are different steps that employers can take with regard to COVID-19 that they cannot take with regard to the flu. The EEOC guidance that I provided earlier, that I linked to in the slide that I mentioned, also kind of touches on some differences there. But that's an interesting question. Marie, will you reframe the earlier question that you asked?
Oh, just the concern. So talking about accommodations, there was essentially a question about whether, a belief that's not necessarily a religious belief also has to be accommodated in terms of, beliefs regarding the vaccine itself and whether it's safe if there's, some sort of uh, malicious actor behind, some of the things that are being said. Whether the vaccine is trustworthy and other beliefs that aren't necessarily religious.
Great question. I said I wasn't going to dive too deeply into accommodation law because it's a pretty deep pool, but I will. I'll see what I can do on that one. One thing that's interesting, I think, about this difference that we've already talked to about the ADA and Title VII is that if you ask for an exemption based on a disability, your employer typically can ask for some medical information to support, what disability you have and kind of what your concern is, if they choose to. They don't have to. So it can be harder to establish sort of the disability, but once you do, your accommodation rights are more robust. On the religious belief side, it's a lot harder, I think, for a company to go and ask an employee, well, what's the nature of your religious belief? And courts have been hesitant to really look too far into that question. And so I think someone who has a religious belief, often a company should probably think twice before they ask for a lot of follow-up information about a religious belief. That being said, Title VII really, it prohibits discrimination on the basis of religion. And so if the thought is, and Marie, this may be what you were alluding to, that I just am an anti-vaxxer, I don't like vaccines, or specifically, I don't trust this vaccine, that very likely does not qualify as a religious belief, and I think would not be protected. And so I think in that type of situation, I don't think that that's necessarily grounds for an exemption under Title VII. Now, you may, as a company, decide that you're going to handle those things differently, but I do think there's a distinction between someone saying, as a part of my religious beliefs, I can't be vaccinated, and I'm just really skeptical about this vaccine. This is my lawyerly disclaimer. As we start to look at some of these issues, I hope that we've conveyed the complexity of some of these questions about accommodations and what's out there. I will just mention, and I think Marie made a great point, and I saw another question in the chat that said, how are accommodations going to be viewed in this new environment where so many people have been working remotely? I do think it's going to be difficult for a lot of companies if they say, we couldn't accommodate them by having them work at home, even though they did so successfully for the last 9 months. That may be a difficult legal argument. And I don't think it means that every company is going to be required to allow every person to work at home. I think there are a lot of positions that are difficult to do at home or that cannot be done as effectively there. But I do think that that's an accommodation that courts are probably going to look at very favorably moving forward. Another accommodation that we could see is you could see a situation where a company says, okay, if you've been vaccinated, you no longer, and this would be in the future because there are requirements around this. A lot of states already are requiring this, but a situation in the future where a company says you don't need to wear a mask or social distance if you've been vaccinated. But if you haven't been vaccinated, you need to continue to wear PPE in our workplace and maintain social distance guidelines. And, that's not necessarily a perfect situation, I think, for people that need an accommodation, but it certainly could address the concerns that a business may have about, infecting others with COVID-19, and it could allow people to come back to the workplace. And so I think you're going to see situations where we start to have companies thinking creatively about how they can accommodate people, and we'll see areas where accommodations aren't possible. So let's look just quickly at best practices for voluntary policies. Again, if you're going to really encourage people to be vaccinated and you're going to tell them that they need to be vaccinated by their healthcare provider and by a pharmacy, it's a best practice and to pay individuals for the time they spend being vaccinated. Some companies are considering offering an incentive, and one of the incentives that we have seen that's an option within our policy is a one-time payment toward employee health insurance premiums. This is an incentive that's tied to our desire to help people to be healthy and safe. And I think is an interesting one where a company says, if you're vaccinated, we will contribute an extra $50 towards the employee portion of your health insurance premium. You could also see companies giving out swag or other things. If you have a voluntary policy, it is still a good idea to ask individuals to submit verification that they've been vaccinated so you can monitor the success of the policy. Then companies can understand how many of their employees have been vaccinated, how their policy is working. I think this is a dynamic situation where a company may start out as voluntary and want to move to mandatory, or they may feel like a voluntary policy is meeting their needs and they can stay there. But it could be difficult to know without having individuals submit a verification form. That form can be much easier in a voluntary policy because you don't have to have the exemption part of it that we discussed earlier. And then I think, especially in a voluntary policy, if you're going to encourage your employees to be vaccinated, you also need to explain that they will not face adverse employment actions if they decide not to be vaccinated. And I think that's a key aspect to a voluntary policy. So as I mentioned earlier, I think there are going to be a lot of different ways that companies handle vaccinations. What we've done is we've taken our document generation engine and we build an engine that generates vaccination policies. And so it asks a series of questions about, who the contact person should be, whether you want to make your policy voluntary or mandatory. And in the course of just a handful of questions, it takes that information and if we move to the next slide, puts it right into your vaccination policy. And it creates a full vaccination policy based on your answers, a customized policy. And so this engine, I think, is one way that you can help that employers can generate these types of policies that are new and different than things that we've seen in the past. The other thing that we're excited about our engine is that it allows us to update the policy. And so those that have purchased our return to work tool set, either directly or through one of our partners, our vaccination engine has already been loaded into your return to work tool set. And so at the close of this webinar, you can go into your tool set and try the engine out already. It's there. But as things change, we'll have the ability to update the vaccination engine, because I wouldn't be surprised, and I mentioned this at the beginning, if we were to receive some interesting changes in the law or best practices when it comes to vaccinations and specifically vaccination policies. I want to be mindful of people's time. We try to keep these to an hour because I know that you're busy, but I see that the Q&A, at least mine has a little 8, which makes me think there are a lot of questions in there. Marie, are there any that we still need to answer in our remaining few minutes?
Yes. One that I thought you could address would be, you were just talking about updates to the policy. Someone asked, will there be a time in the future where a vaccine requirement would no longer be relevant for companies because of the idea of herd immunity or lower risks associated with COVID, and like renewing and updating? How would you renew or update the policy?
So I love that question. It has like a hopeful sheen to it, right? It sometimes feels like we'll never emerge from this. I'm hopeful that if you came up with a vaccine policy, you may only need it for a year or so. And I think, like a lot of your policies, and this is, I think, a great point that comes out of that question, you're going to need to keep checking it and updating it and make sure that it's current, because there could be a time, if we see mass vaccination and we're able to get a handle on the pandemic, there could be a time where maybe a company that had mandatory vaccination doesn't need it anymore, or a company that was encouraging vaccinations doesn't need to take that step anymore. And frankly, to be honest, I hope we get there sooner than later. So great question.
Another one on timing, asking that whether, since the vaccine is still considered experimental or under trial, whether it would be better to wait until it's been officially approved by the FDA before requiring employees to get the vaccine.
Yeah, definitely an interesting question. And, there could be some benefit to waiting. And in fact, you may be able to wait just because of availability, right? I mean, I, uh, I know a lot of people, and myself included. I'd like to get the vaccine now, but I'm not eligible, and so I think there are many people that can't get the vaccine yet, and so you may be able to wait on that basis. And if you wait, that's certainly possible that the FDA may come out with I think it's approved the vaccines on an emergency basis, but may come out with a standard approval. So I think that's an interesting question and one that companies should keep in mind.
Okay, and then a few minutes ago, you were talking about, you know, offering incentives and things for employees to get the vaccine. There was a question about, if you're doing things like that, or if you're paying for time off for people to get the vaccine, how do you go about verifying, that they spent the time getting the vaccine or whatever without violating their privacy rights?
Yeah, I think that's a good question. And this vaccine poses an interesting challenge in that you have to actually go twice to get shots, right? And it's, I think, 3 weeks apart for one of them and maybe 4 weeks for another. And so, you know, presumably people are going to have to leave work on two different occasions. I, I do think that can be hard to verify. And I think that you would hopefully be able to trust your employees. One way you could do is to just say, you can take a maximum of 2 hours each time that you have to get a shot, or you could put some parameters on that. You certainly could have a situation where employees, live far from your workspace or the like, but you would hope that 2 hours or maybe 90 minutes even would be enough for someone to go in, get a shot, and get to the workplace. So I do think that's one way you could do it, is put limits. I would be careful, and I think this is where your question is going, about asking for verification that they were at certain places. I actually don't know what the vaccine cards look like, but they also may provide some information about when people received the vaccine that could be helpful. But I think your intuition is right, that you'd want to be careful about sort of delving in too deeply to, like, going to their doctor and asking when they arrived and when they left.
Yeah, and I might throw out a suggestion to treat it like other things that you may have policies in place regarding, like whether you provide a certain amount of time for people to go vote, for example. The verification is typically simply you ask and they say, "This is why I'm going," right? So, like Ryan said, like maybe you cap it at a certain amount of time that you'll, pay them for as part of your voluntary like encouragement if it's a voluntary policy or if it's required. um, but determining that you'll ask and rely on their self-certification, which is what you do in the majority of cases for employment policies. You're usually asking them to self-certify things. I understand and I agree to abide by this, they sign. So that is something to think about. How do you do it in other situations? um, we are at time. I don't know if you have a couple more minutes. We still have people who are on if you want to answer in
Yeah,
person, Ryan.
I'm just pulling up the questions now. It looks like we have two questions that are very similar. Could an employee sue an employer for requiring vaccinations if the vaccine is not approved by the FDA, or while the vaccine is not approved by the FDA? I think that would be a difficult suit to maintain, just based on the EEOC's guidance that employers can require vaccinations in most situations. And so I'm not sure what the basis for that suit would be. I think that might be a hard one to bring. Although I will say, there are some creative litigants out there.
Yeah, and I would also say the fact that there is, the temporary approval that's been given, um, will also offer that additional protection. So it's not like it's an untried vaccine that you're sending people across the border to another country to get because it's not legal in the United States. It has been given limited approval, so there's a protection there as well.
Yeah, I think that's a great point. I have a good question here from Claire. Is there a liability risk if an employee sets up a vaccine site for employees but has them sign a waiver regarding liability side effects? So I think there are a couple issues here that I see, and if this is something that your company is considering, I would suggest talking to an attorney about your specific situation. But let me just do some issue spotting for you. One, if you're contracting or providing the vaccine, you're going to have to ask your employees medical questions about their conditions and whether they are allergic to things. And that's a medical examination. And so you're going to have to meet the standard for a medical examination. Now, I think that's a standard that employers may be able to meet, but it's maybe not something that they need to take on. The second thing is, and I'm really glad, Claire, that you brought up waivers, because some people have said, well, and this has been an issue throughout the COVID-19 pandemic. Should we have our employees sign a waiver to come in? Should we have our, I think there are some real downsides to waivers. One, I think they're unlikely to hold up in most courts because there is not, courts often look at sort of the relationship between the two parties and contractual matters like a waiver. And there is not a balance of powers between the two parties there. It's, do you want to come to work and have a job? Sign the waiver. A lot of courts just won't enforce that. And two, I think waivers are problematic for other reasons as well. I think they can send a troubling message to employees. Now, that being said, I know there are companies out there that use waivers, and they have looked at them and decided that waivers work. But I will say that in the context of COVID-19, I'm hesitant to recommend waivers.
Without going against Ryan's advice, because I am also hesitant to recommend waivers, I would say if you have a voluntary policy, your waiver would definitely bear more weight than if you have a vaccination required for coming into work. So there would be a difference there, but they still are problematic for a lot of reasons. I definitely wouldn't have your employees sign one that you draft without the assistance of counsel.
Yeah, great point, Marie. If it's voluntary, then you don't have sort of some of the coercive aspects that I think courts worry about. I think that we've answered a lot of these. I'll maybe just hit these last three quickly. Do you think an employer can put up information about what percentage of employees have been vaccinated? Yes. I mean, as I think more about it, I do worry a little bit about the idea of saying everyone here's vaccinated, because then you're sharing information maybe about folks. But I think, that would be an interesting issue. And I think that that's one that I hope that we'll receive guidance on, how you could, if you could use that information in advertising or the like. I would say that that's something to watch out for, because I do think you need to be careful. Now, your point, and you said this in the question, is that you're not providing individual information about any specific employee. And I think that that's correct. And I think that your employees would probably have a hard time bringing suit saying that you disclose their medical information. But I do think, that you're walking a bit of a fine line. Marie, what?
Yeah. So I would say this actually also touches on another question that's in the chat. One side of it being the privacy concerns for your employees. So I would definitely not issue numbers that are so all-inclusive that they would essentially give away personal information. So if you're to say like 99% of our workforce is vaccinated, when we talk in the privacy world about de-identification, if you give away enough information, you've essentially identified people. So, so saying something along the lines of the majority, or, we have a vaccination program for our employees, so that the public can understand that you're taking really affirmative steps without you giving away too much information, is probably a safer way to go there. But conversely, there may be situations where you need to verify employees' vaccinations, or you have employees unwilling to go to work on site with a client if they don't know that the client has some kind of vaccination policy in place. This goes to another question that was in the chat.
Yeah.
So this is where I would say a lot of it's going to depend on your industry and the workplace safety requirements in your industry. Somebody had mentioned in the chat earlier that they're working with a school system. A lot of school systems are doing things like vaccinating their employees because they're in one of the first groups that's being vaccinated. Same thing with, healthcare systems. So you may be in an industry where, because of requirements, regulatory requirements, you can say things like, our employees are all being vaccinated because we're meeting this regulatory compliance requirement. Or where you could say, we require our customers to verify to us that they have vaccinated a certain percentage of their workforce before we will send our employees to those customers' sites. So you can think through the nuances of that. There's not really an overarching answer that, both addresses the privacy concerns, but also the safety concerns within your own organization, but also within organizations your employees might be servicing.
Yep.
So some of the privacy concerns can be allayed if there's regulatory requirements that force you to meet certain vaccination or other screening standards.
Well, I'll just finish up by answering Claire's question. I think I understand it, and Claire's asked some great questions today. This is, can you still have your disabled employees fill out the standard ADA form? So there's standard forms for requesting an accommodation. I think the answer is yes. And I would hope the businesses already have a process in place for people to request accommodations, and if they can utilize that in an efficient way, I think that makes sense. I appreciate all of you who have stayed to the bitter end here as we've gone over to answer questions. But I really feel like this has been, at least for me, a very interesting conversation as we've looked at an issue that's likely to evolve over time. And so we appreciate your participation. If you have any questions about the products that we've discussed, feel free to go to www.sixfifty.com. And please join us for future webinars as we continue to discuss the return to work, privacy, and a lot of the other areas that we cover with our products. Thank you,
Thanks.
and have a great day.